Let me ask you something. You've been paying into Medicare your whole working life. Decades of premiums.
The test results are in.
Decades of trust
positive.
that when you finally needed it, it
thank
would be
goodness.
there.
That's wonderful news, Doctor.
Now you're
Thank
thinking
you.
about retiring abroad. Maybe Portugal. Maybe Mexico. Maybe Costa Rica. And someone tells you, don't worry, you've got Medicare. Here's what nobody tells you before you board that flight. The moment you land in another country and call that number on the back of your Medicare card, they'll tell you the same thing every single time. We're sorry. That's not covered outside the United States. That's not a glitch. That's not a technicality. That is the system working exactly as it was designed. And if you're not prepared for it, it can cost you everything. Right now, there are over 760,000 Americans collecting Social Security benefits from abroad. And that number is climbing fast. Between 2018 and 2024 alone, it grew by more than 40,000 people, and that's just the ones officially on record. In 2024 and 2025, retirees accounted for 62% of all U.S. citizens relocating abroad. That's not a trend anymore. That's a movement. A February 2025 Harris poll found that 52% of Americans believed they could live a higher quality of life outside the U.S. And they're not wrong. In most popular expat destinations, you can genuinely cut your monthly expenses in half. Sometimes more. But here's where the dream runs headfirst into a wall. Almost none of these people fully understand what happens to their healthcare the second they leave American soil. Let's talk about the numbers. Because this is where it gets real. As of 2026, your Medicare Part B premium is $202.90 every single month. That's the standard rate. If you're in a higher income bracket, you could be paying $300, $400, even $500 a month. That $202.90 starts looking like wasted money real fast when you're living full-time in Medellin or Lisbon. Because here's the brutal truth. Medicare does not cover medical care received outside the U.S. Original Medicare, Part A and Part B, is designed for healthcare services within the U.S. and its territories. Not in Canada. Not in Mexico. Not in Spain. Not in Thailand. Nowhere. Your prescription drugs? Part D won't cover prescriptions you get outside the United States. If you have to buy medication from an international pharmacy, you should expect to pay 100% of the cost out of pocket. Let that sink in for a second. You're paying $202 a month. And in return, if you have a heart attack in Lisbon, Medicare pays exactly $0 toward your bill. Now here's where it gets even more complicated. And this is the part that catches people completely off guard. Let's say you move to Portugal. You realize you're paying $202 a month for coverage you can't use. So you do what seems logical, you drop Part B to save money. Sounds smart, right? Here's what happens if you ever want to come back. The 10% rule. For every full 12-month period you were eligible for Part B but didn't have it, your monthly premium increases by 10%. And this isn't a one-time fine. You'll pay that higher premium for as long as you have Medicare. So if you're abroad for 5 years and then come back, you just gave yourself a 50% permanent premium increase. Forever. If you do not keep Part B while living overseas, you may face lifelong premium penalties that will make your Medicare coverage more expensive upon your return. New Medicare. This is the trap. You're stuck in a no-win situation. pay for coverage you can't use, or stop paying and face a permanent financial penalty when you return. There's no good option unless you know what to do. And I'm going to show you exactly what that is. Now let's be honest about something. Not every retiree abroad is in the same situation. And the right answer depends heavily on your specific circumstances. If you plan to travel back to the U.S. frequently, keeping Part B may still make sense, even from abroad. But if you're making a permanent move and won't be returning regularly, the math changes completely. Here's what most financially smart expat retirees are actually doing right now. Many keep Part A, which covers inpatient hospital care, because for most people, there's no premium for Part A coverage. New Medicare, it costs you nothing to hold onto it as a safety net. Then they make a real decision about Part B based on how often they'll be back in the States. And they replace the gap with international health insurance. Companies like Cigna Global, Allianz Worldwide Care, and IMG, these are plans built specifically for people living your life. Many retirees drop Medicare entirely and invest in comprehensive international health insurance, with global coverage including the U.S. Now let's talk real numbers. Because this is where your eyes are going to open. A comprehensive international health insurance plan for a healthy 65-year-old? Depending on your destination country, you're typically looking at anywhere from $150 to $300 per month. Full coverage. Doctor visits, hospitalization, prescriptions, emergency evacuation. Compare that to paying $202 for Medicare that covers you only if you fly back to the U.S. And what about healthcare costs in the countries where most American retirees are actually going? In Costa Rica, the national healthcare system is available to residents for $50 to $100 monthly based on income. Private insurance runs $80 to $200 monthly. In Thailand, a knee replacement that costs $30,000 in the U.S. runs $10,000 to $13,000 in Bangkok at internationally accredited hospitals. In Portugal, you pay modest fees of €5 to €10 for appointments and small co-pays for prescriptions, but major care is covered under the National Health Service available to legal residents. Mexico? Out-of-pocket specialist visits at excellent private hospitals in major cities will run you $30 to $60 per visit, without any insurance at all. The math isn't even close. I want to be straightforward with you here, because I think you deserve that. There are some real risks in this process that don't get talked about enough. Individuals typically receive more benefits the younger they are when they apply for expatriate health insurance. Starting to plan for worldwide health insurance early in your retirement planning is definitely a step in the right direction. Individuals over 60 will find higher premiums and possibly even more expensive medical care. And many insurance plans will only accept new members up to a certain age. Some cap out at 65. Some at 70. If you wait too long to look into this, you may find your options have closed. Pre-existing conditions are another reality check. Diabetes, hypertension, heart disease, many international insurers will exclude these or charge significant surcharges. That doesn't mean you can't get coverage. It means you need to plan before you need it. So what should you actually do? Here's a simple framework that most financially savvy expat retirees are following right now. Step 1. Keep Medicare Part A. It costs you nothing and keeps your options open if you return to the U.S. for major care. Step 2. Evaluate Part B honestly. If you're going back to the States at least once or twice a year for checkups and care, keep it. If you're fully committing to life abroad and won't be back regularly, run the numbers on whether it's worth that $202 a month. Step 3. Get international health insurance quotes now, not when you're already abroad. Compare plans from Cigna Global, Allianz, and IMG. Make sure pre-existing conditions are addressed before you sign anything. Step 4. Research the national healthcare system in the specific country you're moving to. In Portugal, Spain, and Costa Rica, legal residents can access the public system at very low cost. That changes everything about your monthly budget. Step 5. Talk to a cross-border financial planner. Success in retirement abroad will depend less on what Washington provides and more on careful planning, self-reliance, and adaptability. DTA, a good advisor who understands expat finances, will save you far more than their fee. Here's what I want you to walk away with today. 35% of future retirees in America are now indicating they plan to retire abroad. That number is going to keep climbing because the math on retiring in America is getting harder every single year. But the people who make this transition successfully are the ones who don't make assumptions. They don't assume Medicare will handle it. They don't assume they'll figure it out when they get there. They know exactly what they're walking into, and they have a plan before they ever pack a bag. You now know something that most people heading into this decision don't. Medicare will not follow you abroad. What follows you is your preparation. If this video helped you see something you hadn't seen before, share it with someone who's thinking about making this move. Because the people who need this information the most are usually the ones who haven't found it yet. See you in the next one.